peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
Good morning, viewers. Good morning. Welcome to Punchline Africa Television, broadcasting all the way from the Political Command Center in somewhere in Africa. Wherever you are, this is Punchline Africa Television, bringing you a show, My Opinion. My Opinion looks at interesting topics that are making rounds around the world, that are making headlines, but some issues that are documented in some form of investigative journalism. This opinion show is purely designed to teach, to tell, to organize, to alert the people of Africa and the people of Kenya in particular. Are there things that we have forgotten? This morning when I was doing my preparations at about 4 a.m., I came across something that maybe Tawish has already looked at on my Facebook. I got something that when you look back, what do you think? I think let me come back and read what I wrote this morning at about 4 a.m. There are things that you might have forgotten. But this journey, the journey where we are, do you have the same feelings like I have? I sometimes look back and ask why I have to say the truth. But I don't question God. This is me now saying, no, I don't do it. I said good morning, Africa. That was about 4 a.m. this morning. But the thing is, someday you will look back and know exactly why it had to happen. Good morning, Africa. Tawish and my sister, the legacy trend, Sharon Gitonga. Someday you will look back, Tawish, and know exactly why it had to happen. Is there a moment that I wish you look at behind and say, why did it happen? You question God why it has happened. Do you, Sharon, you look back someday and say, why did it happen? Why had it to happen to me? Several people in Africa and several people across the globe look back and say, why did it happen? There are reasons as to why some things happen. One of the reasons is to teach you, to give you experience, to give you warning that next time you don't repeat what you had done before. But when you look back and say, what was I in 1985? A younger person, very vibrant, with vibrant politics, conducting demonstrations, wanting to go wherever I had to go because the energy was much. But where are we today? Sorry. Why had it to happen? The theme of our show today is, why has it to happen? The topic, I think, Tawishi will introduce it. I don't know whether you have the topic. Yes. The topic is very, let me introduce it this way, then you can take it over from me. The topic is a very, very important topic for the people of Kenya. Have we forgotten the protocols? In simple terms, have we forgotten the protocols of the Ministry of Health? How many people in Kenya today, starting from us on this platform, and I want us to be very honest, don't lie to God, because God is not going to be very happy. Tawish, Sharon, and the communication system, my engineers and editors behind there in Nairobi office. How many of you wash your hands, sanitize your hands, wear masks, keep a distance? Be honest. Be honest, Sharon.
I do.
Let me start with you.
Yeah.
Have we forgotten the culture? Have we forgotten that 1 year ago, the world was gone. Life was gone. Our transport was gone. Our nightclubs were gone. Our restaurants were gone. Our churches were gone. 1 year ago. Why did it happen? Did it happen for us to ignore and start afresh where we were? Or why did it happen? Sharon, you are eager to tell me the truth. Are there times when you have forgotten your mask?
No.
Are there times when, how many people, when you go to any supermarket in town, how many people are moving around? How many people are sanitizing before they go and touch those goods in the supermarket? I'm not going to bring topics of politics here on this television without us looking at the welfare of society, the social welfare of our situation. We had COVID. We started blaming the government. Hospitals were full. Beds were missing. No incubators. ICUs were full. How many of Kenyans today are wearing masks? Wacha tuanzie hapo. Let's go. Remember, it is yourself, for yourself and God. Don't tell a story that Kenyatta, because Kenyatta will have his own day and you'll have your own day. Don't tell a story that Kagwe, the Minister of Health, Kagwe. Don't tell a story of Acheng in Uganda. Don't tell a story of Mama Suluhu or Mnangagwa or Tshisekedi. How many people today have immediately ignored and thought they don't even think of yesterday? Is this our culture in Africa? Sharon, take it.
Thank you very much, Dr. Matsanga at the Political Command Center, and a very good morning to all our viewers who are watching us, whether it's their morning, afternoon, or evening, and to all my colleagues, and to Samuel Tawish. It is a pleasure to be part of this, show. And to your question, I personally, I think I am quite cautious, and especially to actually follow and adhere to the MOH guidelines, not because the government has just imposed them, but because I try and look at the people that the people that I love and all my friends. I have lost relatives through COVID. So I know what it means to actually lose very close people. So in that essence, I have been very I've been quite cautious. I cannot leave the house without a mask, and I'm always carrying a sanitizer. Also, to look at personally having a small child, it's even worse, because you do not want to go out and just treat the disease abnormally, because you realize that this, like children have, lower immunity. So if anything, it will end up, the blame is going to be on me. So I think such factors for me are quite of importance, and that's why I'm very cautious to actually adhere to the rules, not just because the government has imposed them, but because of the people, the people that are around me. Thank you.
Thank you very much. Tawish, how many people are aware of the Ministry of Health protocols? If there are any, they start from yourself. You police the MOH protocols in your house. Yes, on your journey, in your matatu, in your car, in your shopping center. Has it been forgotten already?
Thank you so much, Daktari, and thank you, Sharon Gitonga, my colleague panelist, and all our viewers watching this program. Indeed, Daktari, as you have rightly asked that question, personally, from where I sit, I'm a keen observer, and I follow the guidelines given by the Ministry of Health to the latter. The reason is, Daktari, I understand that for us to succeed in the war or fight against this particular pandemic, it must start with an individual. It must start with me. It must start with my family unit. It must start with an estate where I live, and it must get to the entire country. And so when we do that, collectively we'll be able to fight and win the war against this pandemic globally. Dr. Masanga, indeed, you are asking these questions as to whether when President Uhuru Kenyatta did open the country, people seem to have gone back to the normal routine, where they do not wash their hands, they do not wear their masks, they do not observe social distance, they do not even use the sanitizers, and for example, even the normal greeting has come back. And I think people felt like when the president said we are opening up the country, we are opening up the economy, they thought also the disease has really run away. It is important for us to remind the people that this disease hasn't quite gone away. The numbers might have come down, but these numbers have come down because we are going for this vaccination. We were very eager and excited really to follow the Ministry of Health protocols in terms of social distancing, in terms of washing our hands, in terms of sanitizing. And I think these are the things that individually they have helped us really to see the COVID-19 curve really come down. And probably it is what informed the experts to decide that maybe it is time to open up the country. If you came to my house, Dr. Masanga, these are things that I really follow to the latter. The reason is, and I know for sure, Daktari, that this disease is not about the government. The disease is not about President Uhuru Kenyatta. It has nothing to do with the minister, Mutahi Kagwe, or anyone in authority, be it in Kenya or globally, Daktari. It has to do with me. If that disease attacks me today, Daktari, it is me who will lose my life, and I'll also be putting to risk the lives of those around me and those who depend on me. So I have to be very, very careful. That is why even if you came to my house, for example, when I have this mask with me, if I have to leave this house, I leave this door to go out, I must put on my mask. Inside my house, if you go to the washroom, there's a place where you will wash and you have all the necessary detergents to wash your hands. I have my sanitizer, even including myself. When I go out and come back to this house, that is awesome, Daktari. That is it. That is what we are talking about. You go out. If I went out now to go to, say, to a supermarket, or I went anywhere for any errand, coming back, when that door is open for me, I have to go and wash my hands first before I even touch anyone, including my children. And that is the protocol in my house. Much as there's a Ministry of Health protocol, there's also a protocol in my house. Any visitor, and even if my wife is away, when she comes back, she cannot touch anything before washing her hands. If a visitor is coming in here, they must wash their hands. And if necessary, they must actually sanitize before they can greet and even have a conversation or sit down with us. So I think when we do that individually, Dr. Masanga, from where we sit and from our family units, we will be helping ourselves really to fight this pandemic, and it has nothing to do with government. We don't have to wait for government to come and police us, for government to come and monitor and ask whether you've put on your mask, whether you are sanitizing, whether you are really social distancing. This is not important on the part of government. It is more important on us because it's about our life, it's about our health, and therefore we must take it as a personal obligation to observe them without so much supervision. I submit, Dr.
Thank you very much, Tawish. Some of the observations that the Ministry of Health put forward: vaccine, face masks and hygiene, avoiding crowded spaces, hand washing, social distancing, surface cleaning, self-isolation, health and diet lifestyle. Health CS Mutahi Kagwe announced that Kenyans seeking government services, if you have not vaccinated, don't try to go there. But there is one thing that intrigues me in this country, and that is the situation where politicians have gone throttle. They are doing their campaigns. Ruto today is in the Rift Valley, in Narok, walking around in Turkana, Kericho. He has been in Mount Kenya. Other politicians have also been across in most of those places. Are we aware? Are we fully admitting today that this thing is over? It's gone. Because even the population themselves, who are running to go and see this gentleman, as they talk of Kenya of tomorrow, the Kenya of tomorrow, I will be the president. Hustle a nation, Siji, hustle. I don't know. Look, if you look at, why do you run there? Take that air inside you. I agree with Sharon that most of us have lost friends, relatives, close relatives. Most of us have had experiences of this disease. It is very dangerous disease. And for you to ignore this disease and the regulations of the government and go around and tell people that things are okay, come as many as possible. It is sad. And today I am shocked. One of the senators who has himself vaccinated himself, he has vaccinated, he has gone to get his certificate, is telling people that it is not, you shouldn't force people to vaccinate. Do we really have animals here, or we have people? Sharon.
Thank you. Thank you very much, Dr. Matanga. And I think the policy was, quite long overdue, given that there's quite a goal, to have vaccinated 10 million people by the end of the year. And where we sit now, we are, at around 5 million. And also considering that we are, towards the festive season, and also given that we're actually towards a season of political activities. And it's quite sad that I have not had any of these politicians talking to, as much as they're selling their manifestos, I've not had, any of them even actually trying to, sensitize these people, because they come in thousands. And if you look closely, you don't even see anyone, with masks. And I believe any leader who is actually, who means, the goodwill to the interest of the people and has the interest of people at heart, should be a leader who actually, cares about the safety of this person. Because remember, you want these people to be safe, for them to actually vote for you. So if they actually, if they, God forbid, if something happens and, they are sick or, something happens, how are you going to get these votes? So I think it is also incumbent upon, all these political leaders, because it seems that, IEBC has just been quiet about these, premature political campaigns. Now that there's no law, there's no one that has issued anything to call them out for having conducted, early campaigns. Then it's upon them to actually, sensitize and sensitize these masses before they come on board. And I think we touched base on this conversation in the morning. And one thing I kept on insisting is that, well, it was a good idea, but for me, I still feel like, yeah, and the intention is good, but I feel like the methodology and how it's going to be implemented is what is not really viable, given that we have a month to actually have gotten to these, gotten to have vaccinated, the 10 million people. I feel like first things first, that this month, that 1 month that, the CS of Mutahi Kagwe actually said, would have actually been, spent to actually, sensitize and, create public awareness to people, especially at the grassroots. There are people, and I gave an example of my grandmother. I was actually talking to her over the weekend about the same issue. And I asked her if she's actually going to get vaccinated. And this is what she said. For her, she has an issue with, she's been having an issue with blood clot. And from what she's been hearing is that anyone who has had an issue with blood clot, then it is not okay. So you see, to even convince her, it is close to impossible. So there is quite, and she's not the only one. I've gotten so much needs around, the whole vaccination, the whole, vaccination issue. And I feel like first things first, I think for us to get to that goal, there's a huge need, for creating, sensitization and public awareness. When I look at marginalized counties like the northeastern, those are people and those are counties that have actually been declared a national disaster. At this time, their priority is these people are even eating wild fruits. So at this time, what is their priority? Is it to get the vaccine or to even get food? Because they don't see the need of a vaccine, yet they are not even able to put anything on their food. Much could be said, but I think and for me, I largely agree that the intention is good, but I believe because I look at any time when there is a policy, there needs to be, an implementation and, the strategy and the resources about it. Well, I don't really doubt whether there are resources or not, but I look at the strategy, and this is actually trying to, working hand in hand with the community health workers, the chiefs, the barazas, just like they do when they are running, like polio vaccines. They even get, they actually go door to door. So when you talk about the grassroots, we need to actually, create much awareness as to the reason as to why these people actually need these vaccines, and to actually get rid of the myths that have been created around getting the vaccine. Thank you.
So in your submission, are you saying there is not enough education surrounding these medicines?
Yeah, especially at the grassroots, there is little to no information, because there are so many myths that have, come about, getting these vaccines. So people don't really understand. And now I am not speaking about, the urban, I'm speaking about the marginalized, areas, because when I look at this country, we are made of 45 million people in the country. So, and for us to actually reach out, if we actually say we are going to impose, strict rules for, this for everyone, we have to look at the people at the grassroots. Talk about Wajir County, people at, in our villages, our, old people. Our grandmothers, our mothers. So who have there's a high, there's a need to actually educate them on the need, and the government and the Ministry of Health can work hand in hand with the community health workers. They can work hand in hand with the chief barazas who have touched at the grassroots, so that they can be able to pass around this information for people to actually come out and get vaccinated.
Okay, thank you very much. Lack of information, misinformation, fake news, and many other things lead to people not turning up for this vaccine. How far has the ministry done and how far has it gone? You shall look at it. But let me go back to Tawish. Is it the same feeling that you have that there is lack of information, or it is just a mindset by Africans that we wait until the disease knocks at our door is when we crowd? Is it a behavior in Kenya that when things are announced, you don't turn up to run to go to those places, but you just wait until the last minute, then you start queuing when the EBC says the deadline is tomorrow, then you see a number of people running there. Is it just simple carelessness?
Dr. You're absolutely right. I think it is the question of mindset and attitude, a wrong one for that matter, because you've given examples. So, for example, registration of people to go and people to become voters in this country. You've seen IEBC had targeted about 6 million new voters to be enlisted, but we did not even achieve the 2 million mark. And if we did, in fact, it was after even the extension of that voter listing, Dr. Masanga. It is not that we did not have enough registration kits. It is not that IEBC had not deployed enough personnel to carry out this exercise. It is not that this campaign was not being carried out, say, by politicians or even through the mediums of communication like radio, television, and newspapers, and even in the social media. It is just a wrong mindset. And I think there are people who have this fatigue when it comes to elections. They are fatigued by how politicians are carrying themselves in the country. And they have gotten to a point of losing hope completely and feeling like much as they had hoped so much that it is the politicians who provide solutions to the problems that they go through, that is not the case. And I think that is all boils down to the issue of mindset and attitude. On the very topic we are discussing about health matters, Dr. Masanga, and particularly on the COVID-19, it is equally about the attitude and the wrong mindset. I mean, do you need to be reminded that there are people who have lost their lives? I mean, our relatives, our close our friends, maybe even some who managed really to survive, people who are living with us, they got infected with this particular disease, and we have been able to witness this. Do you need to wait until it knocks on your door for you to understand the essence or the importance of going to take this vaccine in the first place? You need really one of your kin to die for you to understand that you need to do to social distance or wear a mask or to sanitize. I don't think we really need to get to those extremes for us to be able to listen into and be able to adhere to the Ministry of Health guidelines and protocols. Dr. Masanga, it's unfortunate you've alluded to the fact that there are politicians or people who are wealthy and they've actually taken the vaccines, they've vaccinated their family members, and they are coming out and telling people it's not absolutely necessary. That even when the government goes to extreme and desperate measures to ask people so that people can find the meaning and importance of going to take this vaccine, they are coming out and pouring cold water on that initiative. I think this is very, very unfortunate. These politicians must appreciate the fact that they have the luxury of affording specialized treatment, or if at all any kind of these diseases strikes them. But we are not. We cannot forget the instances where we even lost very influential people who are well-oiled or have good money, but they are not able really to battle this disease. So this disease, it has nothing to do with whether you are high-profile, whether you are an elite, whether you have money or you do not money. It's a disease that knows no bounds, and it does not matter. And I think when you talk about politicians going about their business, carrying out political campaigns and making people come and overcrowding, it is very, very unfortunate. And I think there are people, for example, Dr. Masanga, if you went to my hometown in Kilgoris, there are people who have never seen Deputy President William Ruto, or they have never really seen our former Prime Minister Raila Odinga. So they usually just hear him maybe on radio, And when they have the chance, they see him on TV or even read him in newspapers, but they've never maybe had an opportunity to have a face-to-face encounter with this individual. So when they hear that such a politician is coming to their village, they will really run. They would want to see who is this William Ruto, who is this Raila Amolo Odinga. So it is not more of the ordinary people, because there's that aspect of excitement as well. I think it is the politician who understand how we are exposing our people to danger by carrying out these political campaigns and gatherings without quite observing the guidelines that have been provided to us. And I think if they care so much, if they care that they want a country and a people to lead, they must first and foremost make sure that they help the government and the Ministry of Health in trying to fight this particular pandemic, because they will want to lead a people, they will want to lead a country, and a country without a people, then you will be leading nothing, Dr. Masanga. It is important that they can be able to step in and help in this effort to fight this pandemic. Otherwise, I think the ministry and the government is doing so far so good. They have gotten into those desperate measures. It may make some of us uncomfortable, yes, but just for a moment, if that is what is going to compel us really to go and take this jab, so be it, Dr. Masanga. We are getting into the festivities, just like Sharon has spoken about. You are going to see people merrymaking, going into discos, going into these public places like the beaches and even the hotels and the restaurants without quite observing this particular, protocol. So if that is going to be a directive that we must quite get that vaccination before we can get the privilege of attending these events, I think, Dr. Masanga, it is a desperate move, but it's absolutely necessary that we get into such level so that our people can find the necessity and importance of taking this jab. But as I finalize, Dr. Masanga, I think government must also be very careful not to create a loophole where the enforcers of this particular directive and policy are going to use it to exploit the vulnerable and exploit unsuspecting citizens in this country by way of bribery for them to get these services, even if they do not have the vaccine. Those are things that are likely going to happen if you're not observant, and if government cannot give quite a very stringent directive that even the police, for example, you do not have, yes, this vaccination certificate, but you need to get this service. When you don't have, maybe you have to part with a few coins and they will allow you access. I think those are the things we must also speak about, and government must be on the watch out. I submit, Dr.
Thank you very much. Viewers, we have 7 minutes to clear up our topic. The question is, how many people in Kenya are willing, are available, are doing the protocols as stipulated by the Ministry of Health? How many? How many do we? I don't think. If you look at the percentage, I want to shock you that over the weekend, I went quietly through 2 or 3 supermarkets. And what I found out is that nobody was even keen at taking that liquid. This. Nobody. Askaris were calling back people, please come. You know, you have seen that, Sharon, come and do this. Why should an Askari call you for your own life? This thing is there, it's still available. How many hotels we are going into the season of Christmas? If you look at most of the hotels, the health regulations have gone down. And indeed, Tawish, you will be shocked as you prepare to take your children to these hotels. Be careful. Be careful, because there are things that are not working well. People have gone crazy. It's not only in Kenya. In most parts. The other 3 weeks ago, I was in Scotland and London. I observed almost everybody has thrown down the mask. But most of the people who have thrown down the mask are vaccinated. So you can say, okay, fine. But I did not remove my mask while walking, entering the train, or entering Uber, or entering any other means of transport. I kept on my mask. And I kept even up to the door of my house. I went inside with the mask. I forgot, I even sat in the house, Sharon, thinking that I was outside. Until my wife came and said, you take off the mask, now you are inside here. Look, we have a challenge. The challenge is that we have not vaccinated even 10 million people. That means out of a population of 30 million who are supposed to have a vaccine, or 35 or whatever you can talk about, only few people, millions, maybe about 8, have been vaccinated. Imagine it, God forbid, which we don't hope it will come, and it shouldn't come, oh God. But we don't. I told you, when I was beginning this show, I said, what have you looked back? None of you answered me. I don't know why. But there is something in you, Tawish, something in you, in Sharon, that what you look back and say, if it had not happened, is there anything as we conclude from each of you? What do you think you remember most where you are now? Sharon.
Thank you for that question, Dr. Matsanga. And, Tawish actually mentioned that this disease actually knows no bounds. When you talk about any political class or social class, it is, it's a disease that actually doesn't know, it doesn't determine, whether you have how much money or you do not have money. And I remember at some point, a friend of mine once told me that, the hospital bed is the most expensive thing because there's no one who is actually willing to replace it with you. And that is how much health, that's how much to be alive and, to be healthy, really, is really matters. So when I look back, having lost close friends and having lost, relatives that, were not really, meant to, actually, if I can say they died, prematurely. So for me, that is something that, keeps on, it's something that you will never have these people back. And to think that, this is something that is a disease that just came and wiped off, and just wiped off people who are really living healthy and were doing very well. So that is something for me that probably I would maybe not be able to get hold of, having lost very close people. And as I finalize on one of our recommendation that probably I would give, I have seen countries like Rwanda taking, vaccines to the buses. That, coming to a point where, the government, the Ministry of Health actually allowed the public matatus to actually carry in full capacity, and people do not care. And there's also the aspect of, even if they wear masks, they actually wear the masks below them. I mean, they are just, you just wear them for the sake of just wearing the mask. So probably that is something that maybe Kenya can actually borrow a leaf and, take the vaccinations to these public matatus, so that probably we can be able to, curb this disease in one way or another. Yeah, thank you.
But Sharon, before I leave you to go and I come to Tawish as we conclude, do you really need somebody to tell you that you will be sick?
Apparently it's sad, and that is the reality that we live to. And for me, I don't think this is even an issue of and I think when we were actually talking about IBC, and Tawish actually talked about people waiting for the last minute, it is because it is not of priority, and it is something that they do not value, either whether by intentionally or unintentionally. I agree that there's a number of people that actually have just decided, deliberately, we are not going to get a mask. Sorry, we are not going to, go out, get vaccinated. But there's also a number of people at, the marginalized areas that really do not understand why they have to go ahead and get vaccinated. So it is but for me, I think it is a 50-50 issue, especially when you look at the marginalized people. But in the urban and living in the social media era, and every information is actually available to you. Do not need anything. I think it is just deliberate for people, and it is not a priority. So unless the government comes up with such punitive and stringent measures, people are really not going to go out and get vaccinated. So for me, it is a 50-50 issue that as far as you're looking at the urban areas and the youth and everyone, we also need to also look at the aspect of the elderly and the people at the villages.
The people at the villages, yes, they understand that some things happen for experience, some things happen for lessons. We don't know. We leave it to that. Some people are being told there's blood clot. Is it misinformation? Tawish, politicians, have they played a negative role in this field of telling people what next, what can be done? Have they?
They have indeed. Yes, indeed, Dr. I think you're very right on that front, because our politicians are supposed to be role models. They are supposed to be the people we look up to guide us and give us leadership. But I will say, Dr. we lack seriousness in most of our leaders. Matters that call for critical attention, we treat them so casually, save for a few leaders. Last time I was very, very happy with the governor of Makueni, that is Kivutha Kibwana, the professor, during the Azimio la Umoja summit led by Raila Amolo Odinga in that part of the country. You can imagine that the governor had rolled out an elaborate logistical support to ensure that even people who come for that particular summit, and even in areas that they were going to carry out stopover rallies or campaigns, that they were actually, I will say, temporal kind of vaccination centers, mobile vaccination centers, so that anybody who feels like they've never had a chance really to go and have this vaccine by virtue of the distance from where they live or accessibility or whatever the reason might be, that they have no reason or excuse not to get the jab. And he made it very clear that all the people who are coming for that particular summit must have the jab, and if they do not have, then they must get for them to access that particular summit. And even the people who are coming for the campaigns, those rallies, he made sure that there were mobile vaccination centers, that everybody who was coming there at least could have a chance to have this particular vaccine. And we all understand that it's free of charge. No institution, no government institutions really charges any money for you to get this vaccine. And you can even also remember that as we head to the summit is supposed to kick off tomorrow, Devolution Summit or conference in Makueni County, Wote, I remember. And the governor has well insisted that there must be vaccination of people who attend the summit, and even there will be vaccination centers for people around that particular region. I think these are serious leaders that we want to see, who are backing up what the government policies and initiatives are in place, so that we can be able to help the government achieve its vision of and mission of vaccinating a good percentage or a sizable number of our people to get this particular COVID-19 jab, Dr. But be that as it may, Dr. Masanga, I really thank God personally that this disease came as a wild animal to us. We have lost relatives. We have lost very close friends. I've seen people who have gotten sick of this disease and recovered. But I thank God this far that I'm able to be who I am and healthy as it is, that I did not, and I haven't contracted the disease so far. That doesn't mean I am that immune to the disease. I must continue to really observe the COVID-19 Ministry of Health protocols for me to be able to protect myself against attack by this pandemic, and equally so to be able to protect those around me, my family, and also my close friends. I think that when we do this from our family units, collectively we'll be winning the war against this pandemic. But I think so far the government has tried its level best. President Uhuru Kenyatta has had to make so many sacrifices, including even locking up the country, having curfews, having lockdowns, so that we can see how we can be able to win this the war against disease. I think we must but just applaud President Uhuru Kenyatta for the sacrifices he has made, even if it meant economy going down, even if it meant people actually having lost their job. It is important because we may struggle and get out of these woods again. We may struggle and get out of the bad economic times and be able, because we are alive, we are healthy. I think sometimes we have to make these desperate measures for us to survive. I thank you, Dr. Ari, and thank you, Miriam. Sharon, I beg your pardon.
Miriam is not there at a wish. You are used to me. But before you go, can I pick your brains that at 3 o'clock, if you have time, let's look at the diaspora dispatches in a different way. Look at the topics that you would like to talk about if you are present. If not, I will be at 3 p.m. But can I pick something from you today, like the ministers that were invited by William Ruto? So far, only one minister turned up. The rest did not turn up. What do you think? What's your comment on that?
It's very simple, Dr. Ari, if I have to make a brief comment on that, because in this country, we have no two centers of power. We only have one center of power, and that is President Uhuru Kenyatta. Nobody else, nobody apart from President Uhuru Kenyatta can purport really to summon ministers or any government officials to any residence or to any place, to any office for any lectures. And I think the ministers who did not heed to that call have really lived up to the expectation of most of us, most Kenyans, if not all, that that is the way to go. If Deputy President William Ruto has any policy, he has anything he wants to communicate to the people of Kenya or to share to cabinet, he's free to go and have a meeting at the cabinet. You know, what Deputy President William Ruto is doing, Dr. Masanga, is keen to creating two centers of power in this country. He thinks he's a co-president to President Uhuru Kenyatta. When President Uhuru Kenyatta is meeting cabinet secretaries at State House, he also thinks that he can equally summon ministers at his current residence to give them lectures and directive on a number of things. And the reason why I think these ministers also did not go to that meeting, because they knew it had nothing to do with government policies. It had nothing to do with services to the people. It was more to do with lectures and being told what to do in politics. You see what he did last time when he went to Meru. He was trying to be so good and soft. We know him. Sometimes he camouflages to appear a very good person, a very nice person. Now he's praising Peter Munya. That is a very good guy. He's a performer. I knew he was trying to massage so that maybe Munya could find reason to go and attend the meeting at Karen. But I think it's good that the die is cast, the line has been drawn, and we know who is for President Uhuru Kenyatta. I think that is the message that you are taking home. I submit, Dr. Ari.
Thank you very much. And Sharon, your comment on that, briefly.
Thank you, Dr. Matsanga, and I largely agree with what Awish has said. I had also, seen it coming that this, meeting was not meant to actually take root, given that the president is actually the supreme authority in any country, and we cannot have two people trying, someone trying to try and compete for power. Someone that has not even been in the office, he's been busy campaigning, and there's no one who has actually called him out. And I think we actually talked about this in the morning, whereby IEBC just recently now came out to issue a notice, and the biggest question was why now, given that the deputy president has been campaigning even way before, but the moment that the former prime minister declared that he's about to actually give an announcement parliament come the 9th of December. Now, this is the time that they were actually giving issues. So someone that has not even been involved in any project, he does not have any right to actually sit and summon these people. So for me, I think it was, it was not something that really comes as a because I had actually seen it coming and I didn't see, this meeting actually taking root. And why, my biggest question was why then did they really have to go at, the current president? I submit.
Okay, thank you very much, folks. For me, you know what I can say today? And Sharon, I don't know whether you can lead me with some words. I can't say I told you, but I will only say, I leave it to you Kenyans now that some of us have picked very bad names for saying things which are correct. But we shall continue to say it as it is, Sharon. This was seen, it was known that this guy was not coming. These guys were not coming. Because I have maintained time and time again, Tawish and Sharon, that this man is a ghost worker. So why do you go and meet a ghost worker? To do what? I don't know where the president will physically attend the summit. Because I saw some reports that the president was in South Africa. Was it? Did you pick that one, Tawish?
I haven't quite confirmed, but he could be back because the summit will run about 3 or so days.
3 what?
I think you're talking about the devolution summit, or which one?
No, there's a summit in South Africa called KESA, and I think he was actually one of the chief guests. So I don't think he's around.
The president is in South Africa, so
yes, he's in South Africa. Yes,
he's not. He might not be able. He might attend the meeting virtually because I see stress. Stress being introduced by a person who has just been insulting you the other day. So it complicates the meeting. It could be virtual address. If you look at the governors who have just attended, 2 governors from outside Hustlers Nation, the one of Kisumu and the one of Laikipia, because the docket falls under the Laikipia governor for the conference, so he couldn't miss. If you look at the PS, Korir and his other PS, all of them, those are Oda PS. And then the finance sent a representative there. So we have spoiled our national image. Because now if you appear there and the man comes out with you on the platform, on the house in front, they will say you have now joined. The bloggers will say you have joined UDA. You won't be able to work properly with your people in the ministry. So some of them, that's why they did not turn up, and the various other reasons. I want to thank all of you. I want to thank my Fundi wa Mitambo back in the studio. Is it Fundi wa Mitambo? I am learning some Swahili and
yeah, that is okay. That's correct.
Sharon is just laughing at me. This is part of learning exercise. Fundi ya Mitambo. I want to thank all of you and I want to thank all the people who have heard, listened, enjoyed our show. Let's look at 3 p.m. East African Standard Time today, where we shall have the Diaspora Dispatches, and we discuss it in a different way. Thank you very much. Back to you in the studios. I'm Dr. Matsanga.
Peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.